Hi guys, my name's Faye and today I'm going to talk to you about nerves. The head is made up of 12 cranial nerves, all stemming from the brain. Some of the nerves are motor nerves, which supply the muscles. Other nerves are sensory nerves, which supply pain. As dental nurses, we only actually need to know 4 of the cranial nerves, which are as follows. The trigeminal nerve, this is the 5th cranial nerve, and this supplies the teeth and the surrounding soft tissues and the muscles of mastication. I'll go into more detail about the trigeminal nerve and how to remember it in a moment. The next nerve that you need to remember is the facial nerve. This is the 7th cranial nerve. This supplies some taste sensations and some of our salivary glands, and it also supplies the muscles of facial expression. The next one is the glossopharyngeal. This is the 9th cranial nerve. This supplies some taste sensations and the parotid salivary glands. It also supplies the muscles of the pharynx. The final one that you need to remember is the hypoglossal, and this is the 12th cranial nerve. This supplies muscles of 2/3 of our tongue, and it also supplies the glenoid muscle. We're now going to look at the trigeminal nerve closely. When it says trigeminal, that's exactly what it means. It splits into 3. So tri splits into 3. The way that you can remember it is if you take your fingers and you pop your 3 fingers on your face like this. So your top finger would represent the occipital nerve. Your middle finger would represent the maxillary division of the trigeminal nerve, and your bottom finger would supply the mandibular division of the trigeminal nerve. So these are the 3 divisions that you need to know. Coming off of the maxillary division, we have the nerves of the upper teeth. So we'll start on the buccal side. So from the upper teeth, we do it where it goes anterior, middle, posterior. So in your mouth, it's anterior, so that's your front teeth, middle is your middle teeth, and posterior is your back teeth. Now the nerve that runs along here is called anterior, middle, posterior, superior dental nerve. Now the way to remember it is if you draw it on your face, so you've got the anterior at the front, the middle and the posterior. And if you think of your manager as your superior, that's how you can remember the superior part. Now the anterior superior dental nerve supplies teeth 1 to 3. The middle part supplies teeth 4, 5 and half of 6. And the posterior part does the teeth from 6 backwards on the buccal side. On the palatal side, we have 2 dental nerves that you need to remember. So you've got your nasal palatine. So the way to remember it is your nose, and palatine from your palate. So this supplies teeth 1 to 3 on the palatal side. And then the greater palatine, which supplies the rest of the teeth on the palate side. And the way to remember it is palatine, palate, and then I draw it with my tongue on the inside of my mouth. So you've got your greater palatine and your nasal is at the front. So that's your maxillary parts of your nerves. We're now going to move on to the mandible. So on the mandible, there is only 4 nerves that you need to know. The main one is the inferior dental nerve. So that runs all the way along the bottom of the teeth. So all the way along here. And that will knock out all of the lower teeth on the buccal side. We also then have the long buccal nerve, which again runs on the buccal side, but will only numb up the molar teeth, so from 6 to 8. The next nerve is the lingual nerve, and that is the one on the inside, and that's pretty simple to remember because if you think of your lingual surfaces of your teeth, this is the lingual nerve, and this actually supplies the whole of the lower teeth on the lingual side. The final nerve that you need to know is called the mental nerve, and this supplies the front teeth, so along here. So the ID nerve then turns into the mental nerve. And the way that you can remember it is, again, by drawing it on your face, like so.